Everyone, this is something that affects all of us when we do our restorative dentistry, and that's our curing lights. If we use our curing light and we shine that curing light on a tooth for 5, 10 seconds, 20 seconds, do we really know that's curing that composite? And that's the hard part, because if it's not curing the composite, one, the restoration is going to be sensitive, it's going to stain, it may even fall out. So that makes our job really difficult. It's kind of like a good piece of bread, right? Brown, hard shell on the outside, nice and crusty, and on the inside, it can still be soft. And when we use our curing lights, we can have that same problem. And so that's what I want to address today. That what we have to do is when we are using our composite restorations or something that takes the energy of the light to actually make it cure or harden, it's important that we don't cheap out on this part. I've bought some of the cheap lights. When I do hands-on courses and we have to ship our curing lights around, we don't spend thousands of dollars on our curing lights when we're working on a typodont. But what we'll do is we'll buy some cheap throwaway curing lights, $25, made overseas, and we'll use those. And you know what? When we're doing a hands-on workshop and we're curing a composite or bonding on brackets so a typodont, they work just fine. But I wouldn't use that in my patient's mouth. Why? Because they have blue light coming out, but we really don't know how much energy is in that blue light. We really don't know if that blue light, once it hits the tooth, is it collimated? Is it going to stay around that tooth surface area, or is it going to just disperse? We don't know where it's focused. So there's a lot of we don't knows. And when it comes to doing something clinically in my patient's mouth, I don't want to think that it's doing a good job. I want to know that it's doing a good job. And I think that's the difference. So when we even bring our curing light, if you look at this diagram on the right-hand side, some curing lights are more built for anterior teeth. So they have a light guide that's just curved. When you look at something like the PinkWave curing light, the light guide comes off at 90 degrees. What's the difference? If that light guide is angled, we could get what we call shadowing. So the light guide here is coming off at an angle, and it's very tall, which means it makes it more difficult to get to, let's say, a second molar. Well, if we can't get the light guide directly over that second molar to provide that light energy to cure our adhesive or our composite, what we get is we get these shadows. So the shadow area in here is just showing that, let's say we put our adhesive on the internal walls of this preparation. The light never gets there to cure that adhesive. Let's say our composite is in this area, and when we go to cure our composite, this hard part, the part that we would poke with our instrument or with our burrs to adjust the occlusion, will be hard, but this area in here may still be soft. If that's soft, what's going to happen? That restoration is going to have sensitivity. It could fall out. It's not going to be a good thing for our patient. And that's ultimately not a good thing for us, because we want the best for our patients. The other thing is, when we look at the depth of a box, oftentimes a box is going to be 5 to 6 millimeters deep. Will the light penetrate that far? Will the light get through our composite and cure the gingival floor of that preparation? We don't know. Another thing we don't know is the wavelength of our curing light going to cure whatever it is that we're curing? Because different photoinitiators require different wavelengths of light to actually polymerize them. So what we have with the PinkWave curing light is we have 4 different wavelengths. So we have the ultraviolet and the blue, and those are kind of what we find traditionally in a curing light. But sometimes you only have blue, and so with our most common photoinitiators that we have today, we want to make sure we have those 2 wavelengths. Then, why do we have red in the near infrared? Well, what Vista Apex found out was that if you have the near infrared, that we actually had less polymerization shrinkage stress on the tooth from the composite. What does that mean? Well, we know that if we have a big bulk of composite and we cure that, as it cures and polymerizes, it actually shrinks up a little bit. If we've adhered that composite to the axial walls of the tooth, and now that composite shrinks, it puts that tooth under stress. And that's one of the reasons why sometimes we'll get the white line there, or the patient bites on their composite and they have sensitivity because the tooth has some flex built into it. So what they found was, with the near infrared especially, that enhances the curing so we don't have that stress, decreasing it by, some studies say, 26%, which is pretty significant. The other nice final result is that if we don't have that shrinkage and we have that depth of cure, we're going to have decreased marginal staining of our composites, minimized chance of micro leakage and secondary decay, which is one of the most common reasons why we have to replace direct composite restorations, and reduce patient post-op operative sensitivity, because we don't like when our patient comes back in the office and says, ever since you did that filling, and that tooth never hurt before, but ever since you did that filling, I'm having sensitivity. And it could be because of our curing light. So we want to make sure we use quality curing lights. This is just the PinkWave, just showing you how it just lights up the entire mouth. It is bright. We use this in our live patient treatment programs, and many times the doctors have never used it, the PinkWave curing light, and when they see that work, they go, wow, this is like a really good light. So it also saves time, because when you're doing multiple restorations or larger restorations, like let's say a veneer on a central, what I've always told doctors to do, if you've got a light guide that's like a 7mm light guide, so it doesn't cover the entire tooth, is cure the gingival area first, then kind of overlap it, cure the mid body of that veneer, and then overlap it and cure the more incisal, and then come back on the back side, the lingual side, because we don't really know how well that light's penetrating that restoration. Well, today, with our PinkWave curing light, because we know that it is a quality curing light and it has that big lens, what we're able to do is we can take that curing light, put it over that veneer, I'll cure the facial, then I'll cure the lingual, and then we're done. So when you're doing a lot of restorations and you're doing a large surface area type restoration, having that large light guide is helpful. When you have your curing light, just make sure that you know that it has sufficient output. Make sure it's a quality light. Make sure that the lens, the light guide lens, is clean. Sometimes it gets dirty. Sometimes you have composite stuck to that if you're not putting the plastic sheath over it all the time. Make sure you keep your curing light close to the surface you're trying to cure, because again, the further away it is, the lower the intensity of that light is. And then position your curing lights properly so that you don't have the shadowing, as we talked about before. So these are some of the key concepts of using your curing light properly. Now, when you go to some of the added features, the PinkWave has a transillumination, and you can actually put a little lens over the light guide of the PinkWave to concentrate that transillumination and see your cracks or fractures better. This is actually a little hood that goes over the PinkWave. It just slips right on. And this has a tacking tip. The tacking tip just has a 2.5mm diameter. So now we don't have the 12.1mm lens, but we've condensed that down to 2.5mm. What I find is when I put a restoration in, whether it be a veneer, whether it be a crown, on the margin, buccolingual of a posterior crown, or the gingival facial margin of a veneer, I put this tacking tip right at the margin, right at the gum line. I cure that margin for 3 to 5 seconds so that it doesn't move. Now I can go and floss the interproximals. I can wipe off all the excess on the other side, or on a veneer on the lingual side. I can do all my gross cleanup of my restorative material, and that way when I do my final cure, the cleanup is going to be much easier than having large amounts of composite that's cured. So this is just doing some crowns on the anterior. You can see when we place the crowns, we have a lot of excess cement that comes out the margins, and that's what I want. I want to make sure that there's no voids or air bubbles underneath that resin cement. But I don't want to cure that, because then I would have a lot of cleanup to do. So what we'll do is we'll wipe off the excess and then bring this tacking tip up, and it's pointed up at about a 40-degree angle. And by tacking this, now that crown or veneer won't move, I can floss interproximally. I can wipe off all the excess on the lingual, and when I do come across with this large light guide to do the final cure across those crowns or veneers, most of our cleanup is already done. What is still left behind is really thin and easy to remove. So again, having that large lens covers most restorations. On an anterior central, we know most centrals are going to be around 11mm, so this 12.1mm light guide is going to cover the entire tooth. Mesial distal on a molar crown that I'm trying to cure, it's going to be under that 12.1mm, so I'm going to be able to just place this light guide over the occlusal surface of that crown, buccolingual, and cure everything and know that it's cured. What that does, the power of the PinkWave, the wavelengths of the PinkWave, that large lens saves me time, but more so it gives me peace of mind. I know that after I've cured that restoration into place, that I've done all I can to polymerize our cements. So if you're looking for a light, the PinkWave helps you do your job better. It helps you sleep better at night. And I don't know, I think it's a great investment to make. So if you're looking for a curing light, check out the PinkWave. And again, if you like this information, hit like. If you want to make sure you don't miss any of the information, hit subscribe. We are trying to build a community of like-minded colleagues, trying to do the very best for our patients, and that's one of the reasons why curing lights are so key to our success. I'll see you during our next episode, and thank you very much.